From the News Channel 5 Network, this is OpenLine.
Hi, everybody. Rhori Johnston in the chair, filling in on a Monday night. Carrie Sharp enjoying some time off. We hope she is having a great time. But I'm glad to be here. We have a couple of special guests, and we're going to talk about an important topic, everybody, because have you looked at the date? Yeah, summer's flying by. But we still have more summer, and we have the new school year approaching. So our topic tonight is how do we keep our kids healthy and physically healthy, mentally, emotionally safe, not only during the summer, but a little bit as we head into the school. And who knows better than a couple of fantastic pediatricians, and they are from a great hospital, Children's Hospital at Vanderbilt. We want to welcome Dr. Katie Spencer, who's right here. Nice to see you.
Thank you.
Pediatric psychologist, and Dr. Rosemary Hunter is a pediatrician. Specialties other than in pediatric psychology, because I know at Vanderbilt there's so many amazing subspecialties too, right?
Right. I work in the Children's Hospital with children who are admitted, whether it be for medical reasons or mental health crisis.
Okay. And Dr. Hunter, pediatrician. Any specialties or just a family pediatrician?
A general pediatrician at Vanderbilt in our primary care clinic, and I also do a lot of the newborn nursery. So I see families at the beginning as well as all the way through.
We will start off with these two by saying thank you for all your hard work. Can't even imagine what the last few years has been like. You two know what it's been like. But you know, hopefully we've kind of come through it, and we're starting to see more studies done, and it's going to be a while before we really can look back at this whole experience and look at the impact on our kids, not just obviously what the COVID virus had on kids health-wise, but obviously psychologically and emotionally. How do you think we're doing now, 2+ years since the beginning of the pandemic, just overall with our kids? You optimistic?
I'm hopeful. We've certainly seen the mental health crisis. I think that mental illness was on the rise in adolescence, and we see even more of that now. I think all of us had a difficult time coping with the stress of the pandemic and the aftermath of that.
Do you agree?
Yes. We, in the primary care setting, early on, over the last 2 years, we've seen a lot of increased children with weight, emotional concerns or problems. There's a lot of people that when they were all home for a year, not only did they lose sort of some educational gains, which I think we've been seeing with our school data, but that emotional support. They've really clung to the family and really tried to build a supportive environment so that their children can weather this storm. A lot of parents had job losses and periods of unemployment and now gaining employment again, but we saw an increase in food insecurity in our clinic, and it sort of had a lot of ripples.
Do you think that you mentioned food insecurity, and basically, you know, these terms that we use, and also food deserts, we've covered this extensively on News Channel 5. This is where there are areas of the city, areas of the state where people, first of all, do not have access to fresh, healthy food. There's just nowhere near them to get that. Instead, they are buying a lot of food that's processed and just generally not as healthy. And the other thing is food insecurity, because they just can't afford to keep putting a good meal on the table. So obviously that affects. You mentioned prior to the pandemic we were already seeing more cases. Were we actually seeing more cases, or is this just an incidence of now we are talking more about, probably a little of both, but we're bringing it to the forefront? I talk to my college-age kids about emotional health, about therapy, just like I do physical health. So it's great to be able to, my parents didn't do that with me. I love my parents, but it just wasn't done 30, 40 years ago. Right. So it was a combination of maybe we're talking more about it so more kids are coming forth and getting the treatment, or is it really becoming an issue?
I think it's a combination of both, as you're mentioning. I absolutely agree. We're seeing more severity of mental illness, so more children and adolescents who are coming to the hospital in a mental health crisis. So who are at risk to harming themselves or others, or highly aggressive and unable to stay safe at home. And I think part of that may be due to the limited resources, and that those resources are hard to find. And as you're talking about food insecurity, that family may also have a hard time finding resources that they can access. And the lack of resources for a few years, I think, did lead to some of these problems kind of going unnoticed or unmanaged until they're so severe.
Yeah, we have to keep beating the drum for our lawmakers. And I mean, this is one of those issues too, from what I can tell, it's just not a partisan issue. It's just kind of common sense. As taxpayers, we have to find a way to get more resources to help folks and talk about it, get it out there, which we are, which I find is fantastic. I mean, it's really needed. I'm sure you, with families, it's something you want to openly discuss. How are you feeling? You know, what are the signs?
Right, and we do, and most pediatricians do screen for emotional health of young people and children, and as well as, so early on it might be a little more developmental issues, and then as they get older, we get more into the young child's emotional health and how are they doing in school and how are they getting along with their peers. So this is a way that we're regularly screening children for issues in the family, and trying to keep that open line of communication so that if things change, that they always know we're open and we want to know these things because they are important for their whole health.
And important for everybody, friends, family, to be able to kind of, you know, spot changes and say something, not be afraid to say something and hurt feelings, you know, which we've heard so much about. Children's, as they develop their brain chemistry, all of that, are some more susceptible to certain, you know, mental illness? And we'll get into physical as well, but, you know, they're just not developed as much and able to make better decisions, or is that not the case?
Well, I certainly think that early childhood experiences play a role with later development of mental illness, and it's not uncommon for a pediatrician or psychologist to hear about kind of aversive early childhood experiences,
ACEs,
trauma,
adverse
ACEs,
childhood
exactly,
experience, right?
and trauma,
we talk
and
about
how that impacts
all the time with nonprofits that I work with, and the impact these ACEs can have later in life. I mean, we think back to our childhood, it went by like that, but there are moments that really impact children emotionally, and we remember those moments. And, you know, we've got to be able to get in there. So talk about an adverse childhood experience. A pandemic, I think, would pretty much do it, especially for certain age kids who just, you know, I mean, as an adult, I'm still having a hard time wrapping my head around what happened the last few years, you know?
Absolutely.
And dealing with everything. But for kids, now that we're kind of coming out of it, you are optimistic, both of you, that with the right work, we can get on the right track, right?
I hope so, with the right resources and building resiliency in children.
So what we do know about ACEs is that one of the most protective factors on these adverse experiences, because you can't protect against everything in life, right? Sometimes things just happen. And so, but one of the most protective things is actually having a safe, stable, nurturing adult in that child's life who helps them weather that storm, who talks to them about it, who shares their feelings and just helps them learn coping mechanisms or helps walk them through that experience. And that is so helpful for the child to protect against significant negative influences from it.
737+. You regulars, you know the number. We want to hear from you. Be sure to call in and take part tonight. We are going to take a break, and we're going to dive in further about, you know, just keeping your kids healthy, overall healthy, not only during the summer, but now as we head back. Two great experts here to answer your questions. Chime in. We'll be right back.